Traditions, superstitions, urban legends, the concept of old wives' tales has been around since the 1st century. Have you heard the one about wearing shoes that can start a baby walking sooner? Or if you go outside with wet hair, you can catch a cold. The list goes on and on. So here to make sense of all these tall tales is Dr. Chris Magovern. Dr. Magovern, welcome. Great to see you.
Good morning, Tanya. Good to be here.
So you must hear a lot of these in your profession. Patients coming in saying, I know I've got this because of this, right?
You do. You also hear them growing up, right? You hear them from your mom and your grandmother and relatives.
And you think if your grandmother says it, it's got to be true, right?
That's right.
So let's go through some of your favorites and some more common ones and see what we can figure out. The first one is butter. Now, they say that butter is good for a burn. You just rub it on and it soothes the burn. Right.
Well, you would think so, right? It's smooth, it can be cool, it can be soothing, and it's certainly readily available in a place where you commonly get burned, in the kitchen. And it sort of makes sense, but it's an absolute myth. It's a bad idea. It doesn't do anything. It's actually bad for two reasons.
Okay.
Number one, when you get a burn, your skin actually continues to cook, if you think of it that way, and it releases heat for a while. If you cover it with butter right away, you're insulating it. The heat can't get out. The burn could get worse.
Wow.
So it's bad for that reason. Also, we have bacteria on our skin. And when you cover the burn with butter, you're sealing that bacteria in, and you're setting yourself up for an infection.
So bad.
So it's a bad idea.
So what should you do?
Cool water. Cool water over it.
Let
it cool down. It'll take several minutes for the heat to dissipate. Then wrap it up in a dry gauze. And if you have some burn ointment, you can put that on. But
wonder how that one ever developed.
It just seemed like the logical thing. You're in the kitchen here. You've got to put something on it, and that's all you had.
That's right. So stick with the cool water. Forget the butter. All right. Now here's one that I heard growing up all the time. My mom would tell me, "Don't do that. Don't crack your knuckles. You're going to give yourself arthritis."
I got this all the time, particularly from my grandfather, who was a physician. He said, "You're going to get big knuckles. You'll never be a doctor or a surgeon." And it's bunk. This is absolutely not true. You think that when you crack your knuckles, you're rubbing bone on bone, but that's not what's happening. What happens is you've got fluid inside of your joints, and you distort that fluid in such a way when you crack your knuckles that little gas particles are released, and they burst. Little bubbles of gas burst in your joint, and that's what causes the noise.
So are you doing absolutely any harm?
You're not. And we've looked at this over the years. We've compared people that have cracked their knuckles with people that don't crack their knuckles, and there's no increased incidence of arthritis or swollen joints. And some people even say, and I actually think it relaxes you a little bit.
I agree. Well, can I ask you whether this extends to your back? Because I happen to enjoy cracking my back.
It should apply to all your joints.
Great. Yeah, so great. Because my husband tells me all the time, don't do that. That's bad for your back. Okay, good. All right. I like that one. Now, what about hiccups? We've heard so many home remedies for hiccups. Do any of them work?
There are so many crazy ones, from holding your breath to having someone scare you to drinking from the other side of the glass. If it works for you, have at it.
Right.
That's my attitude. Is there any scientific evidence that any of these work? Absolutely not. There was one anecdotal report of a spoonful of sugar that was published in the New England Journal of Medicine about 10 years ago. That's the only anecdotal evidence of any science. It doesn't work.
It doesn't work. Nothing works.
They're going to resolve in a couple of minutes anyway, so you're better off just kind of riding it out. And if you understand a little bit of how hiccups work, you can maybe prevent them. It's a spasm of your diaphragm, which is the muscle that makes you breathe, and that's what causes it. And it usually occurs because your stomach, which sits right next to your diaphragm, gets irritated. So if you drink too quickly, if you eat too much or eat too quickly, if you gulp air, which happens to children.
I was going to say, do children get hiccups more often? It seems that way.
They do. It does seem that way, doesn't it? And the other thing that can happen, interestingly, is if you drink warm fluid and then cold fluid back to back, that can irritate the stomach. So maybe try to avoid it rather than cure it.
Prevention. Otherwise, you just have to suffer for a couple minutes and it'll go away.
It shouldn't be long.
All right. Now, this is a very, very well-known one. You feed a cold and you starve a fever. Or is it the other way around?
You got it right. You got it absolutely right. And I always have a hard time remembering, too. I think the bottom line here is you should never starve anyone for any reason if they feel like eating. That's just a bad idea. That's bad advice. But this myth, it's a myth, first of all. It got started in the Middle Ages, back when we didn't have an understanding of how the bodies work. Either you got sick because you were hot or you had a fever, or you got sick because you had a cold and you had the chills. Those are the two types of illnesses you would have. And we thought of our body as a furnace. So we fed the furnace food or fuel. So if you were overheated, you obviously don't want to have any more fuel or food,
right.
so you should back off. If you've got the chills, you want to eat. But that's not correct. What you want to do, Tanya, if you're sick, if you have a fever or cold, is rest and hydration. It really ought to be hydrate a cold, hydrate a fever.
Absolutely. Any medical advice from the Middle Ages probably should be left to the side right now. That was in the days when they used to bleed patients, correct?
They did. They did.
Thankfully, we don't do that anymore either. Now, this one's fascinating. You and I have talked about this before. The myth that firstborn children are smarter. But there's a little bit of, the reason this one sticks around is there's some truth to it, right?
This one is true of all the myths.
Wow.
And my two younger sisters would say it's absolutely not true,
right.
being a firstborn, but there's pretty good data from this. There was a Norwegian study a few years ago that looked at over 250,000 men and women, and they measured their IQs and their birth order. Firstborns had a higher IQ, higher than the middle child, and even higher than the youngest. So there is something to be said for this. And we also know that they're high achievers, the firstborns. 50%, more than 50% of American presidents are firstborn. More than 50% of Nobel laureates are firstborn. 60% of CEOs are firstborn. And get this one, 21 of the last 23 astronauts that have gone into space have been firstborn. So there's something to be said for it.
But do we know why that is? I mean, what came first, the chicken or the egg? Does the firstborn get more of the parents' attention, so that's what leads to the higher IQ? Or is there something about being the firstborn that...
I don't think there's anything inherent about being
right.
a firstborn, but I think you nailed it right on the head. The first point is that you absolutely get your parents' undivided attention, at least for the first 9 months of your life,
That's
right?
True. That's very true.
In case someone else comes along.
That's
I think also you have a tendency to be thrown into a leadership position because you may have younger children that come along, siblings I should say,
so
that come along.
So your parents say to the older one, can you please look after such and
right.
such, and you feel, oh, responsible.
Right. You've got to show Johnny the ropes.
Right,
you're
right.
the guy in charge. And I think also parents may have a tendency to have greater expectations, perhaps, of their first child, and the children pick up on that.
Dr. Chris Magovern, thank you so much. This was fun. We should do more of these. All right, and for more information on this topic and others, log on to the health page at abcnews.com.